Assalamu alaikum. I'm Dr. Sadia. This is the part two of the nasal cavity and paranasal sinuses. In this we discuss the paranasal sinuses in detail, and these are the frontal sinus in the frontal bone. These are the maxillary sinus in the body of the maxilla, and these are the two ethmoidal ear sinuses, which is between the in the ethmoidal bone, which is in between the orbit and the nose. So the paranasal sinuses are the cavities found in the interior of the maxilla. So this is the in the maxillary body, and these are frontal sphenoidal. So this is the frontal sinus, and these sinuses are covered by the mucoperiosteum, and this is the frontal sinus, and these are the ethmoidal ear sinuses. This is a sphenoidal sinus, and these are the maxillary sinuses. So these are the four important sinuses lined with the mucoperiosteum and filled with air, and they communicate with the nasal cavity through the small apertures. These all sinuses open into the lateral wall of the nasal cavity. So this is frontal sinus in the frontal bone. This is the maxillary sinus in the body of the maxilla. This is the roof of the maxillary sinus. It is in the inferior wall of the orbit, and this is the apex, which is over the premolars and the molars of the upper tooth. And this is the body of the this sphenoid sinus is in the body of the sphenoid. The mucus produced by the mucous membrane, all sinuses, the frontal sinus, the ethmoidal ear sinuses, this sphenoid sinus, they are covered by a, all sinuses are covered by a mucous membrane and mucoperiosteum, and forms the mucus. And this mucous membrane forms the mucus that moves into the nasal cavity by the ciliary action of the columnar cells. By the ciliary action of the columnar cells, the mucus enters into the nasal cavity, which is produced by the mucous membrane of the sinuses, that enters into the nasal cavity by the ciliary action of the columnar cells. The drainage of the mucus is also achieved by the siphon action created by the blowing of the nose. And when the mucus enters into the nasal cavity, that actually expelled out by the blowing of the nose, by the cough, by the sneezing. So the mucus which is entered into the nasal cavity from the nasal sinuses, that is actually expelled out by the cough, by the blowing of the nose, by the sneezing, by these different actions, we can throw the mucus from the nose into the outside environment. So what are the different functions of the paranasal sinuses? These are the resonators of the voice. They are filled with air cavity. They are filled with air. The paranasal sinuses, they are filled with air, and they are the resonators of the voice. They reduce the weight of the skull, and they actually warm and moisten the inhaled air, and they are the shock absorbers in case of trauma. So we have four pairs of the paranasal sinuses. We have frontal sinuses in the frontal bone. We have sphenoidal sinus below the body of the sphenoid. We have ethmoidal ear sinuses between the nose and the orbit, and we have maxillary sinus in the body of the maxilla. So these four pairs of the ear sinuses, these are the resonators of the voice, and they reduces the weight of the skull. They actually warm and moistens the air, and they actually act as a shock absorber in case of trauma. They are covered by the mucoperiosteum. They produces the mucus, which are actually moved out from the air sinuses by the ciliary action of the columnar cells. When they enter into the nose, the mucus enters into the nose, that they actually expelled out by the blowing of the nose, by the cough, by the sneezing of the nose. And so these are the different functions of the nose, the paranasal sinuses. So the maxillary sinus, This is pyramidal in shapes. This is the roof. This is the apex. So it is pyramidal in shape on each side of the present in the maxilla bone, in the maxillary body of the maxilla. This is paired, symmetric, located within the body of the maxilla behind the skin of the cheek. So behind the skin of the cheek, located in the body of the maxilla. Roof is formed by the floor of the orbit, and the floor is related to the, and the apex is related to the, sorry, it is written floor by mistake. And the apex is related to the roots of the second premolars and the first molar tooth. So the apex is related to the premolars, second premolar, and the first molar tooth. The maxillary sinus opened into the middle meatus of the nose. This maxillary sinuses opens into the middle meatus of the nose. Sphenoidal sinuses. The sphenoidal sinuses lie within the body of the sphenoid. So these sphenoidal sinuses lie below the body of the sphenoid, and so in the body of the sphenoid, the pituitary gland is present. That is called the sella tertius. Below the body of the sphenoid, it is present the sphenoidal air sinuses. And below the sella turcica, this is the sella turcica where the pituitary gland is present and extends between the dorsum celli and the posterior clinoid processes. So they are the below the sella turcica. Sphenoidal air sinuses lie below the sella turcica and opens into the sphenoethmoidal recess above the superior concave. So there's a gap between, I already described the bone, the gap which is between the ethmoidal bone and the sphenoidal bone. So this is the sphenoidal bone, and the ethmoidal bone is actually the bone of the superior concha. So there's a gap which is called the sphenoethmoidal recess, and that in that sphenoethmoidal recess, the superior concha will open. Sorry, the gap, that is the sphenoethmoidal recess above the superior concha, in which the sphenoidal sinus will open. Ethmoidal ear sinuses, they are anterior, middle, and posterior, or I already described here, between the orbit and the nasal cavity. They are contained within the ethmoidal bone. Here is the smaller ethmoidal bone between the nose and the orbit. So this is the nose and this is the orbit. And anterior middle drain ethmoidal air sinuses drain into the middle meatus. The middle ethmoidal air sinuses opens the bulla ethmoidalis of the middle meatus, and the anterior ethmoidal air cells opens into the hiatus semilunaris of the middle meatus, and the posterior ethmoidal air cells drains into the superior meatus of the nose. So these are separated from the orbit by a thin plate. So here is a thin plate. Uh, they are separated from the orbit. Whenever the infection of the nose, or whenever you develop the influenza of the nose, runny nose, so it can involve the orbit as well. So you have an and the and ear middle ear cavities, orbit and middle ear cavities are these three openings are involved with the nose. So these nasal cavities, whenever you get the infection of the nose, you can have a red eyes in you have a red eyes also. You have a infection or the deafness of the middle ear cavity also, because this middle ear cavity is also connected with the nose by the auditory tube, and the orbit, between the orbit and the nose there's a small bone, ethmoidal bone, that actually contains the ethmoidal air cells. So separated from the orbit by a thin plate of bone, so that the infection can readily spread from the sinuses into the orbit or into the middle ear cavity. So this is another picture which shows that this is the frontal sinus. It opens into the hiatus semilunaris. This is the this is the uncinate process of the middle meatus. This is the hiatus semilunaris. It contains the anterior end is called the infundibulum. It actually receives the frontal sinus. And this is the middle part of the hiatus semilunaris. This receives the anterior ethmoidal air cells. This is the posterior part of the hiatus semilunaris. This receives the maxillary sinus here. And this is the ethmoidal bulla. This receives the middle ethmoidal air cells. This is the superior meatus. This is the superior conchae. This is the superior meatus. This is receives the posterior ethmoidal air cells. This is the superior. This is the inferior conchae. This is the inferior meatus. This receives the nasolacrimal duct. This area is between the superior conchae and between the sphenoidal body of the sphenoid. So this area is called sphenoethmoidal recess. So is a gap between the ethmoidal bone, which this because superior conchae is formed by the ethmoidal bone, and the this is the sphenoid bones is a gap between the ethmoid and sphenoidal bone. So this is called sphenoethmoidal recess, and this a recess or gap receives the opening of the sphenoidal sinus. So these are the different openings of the different sinuses in the lateral wall of the nose. Acha, how you will examine the paranasal sinuses? You can examine the paranasal sinuses by a by a by a speculum. Okay, this is the maxillary sinus, frontal sinus, ethmoidal ear sinuses, and the infection of the sinuses is called sinusitis. Yani this is the inflammation of the sinuses is called sinusitis. And this is the frontal sinus. This is the maxillary sinus. This is the roof of the maxillary sinus along with the inferior orbital margin. And this is the apex over the premolars and the molars, second premolar and the first molar. And this is the empty maxillary sinus, and this is the filled maxillary sinus because its opening is blocked into the lateral wall of the nose, so it is filled with the pus and the mucus, mucus and pus. So this is this, and if these sinuses become blocked, they become the area around this become painful. If the frontal sinus get blocked, it causes the headache and the heaviness of the eyes. If the maxillary sinus get blocked, it causes the tender areas over the ear and the eyes. So here the areas become tender. And so if the basal skull fracture, basi-occiput, base of the skull become fractured due to any trauma, that leads to the release of the cerebrospinal fluid through the nose and through the ear. So that these sinuses are filled with cerebrospinal fluid in case of the fracture of the base of the skull. So the infection is called sinusitis, and this the yellow infected sinus, maxillary sinus is filled with the pus. This is the infected pus filled with the maxillary sinus. So these are the different sinuses. These are the ethmoidal ear sinuses. These are the frontal sinuses. These are the maxillary sinuses, and the sphenoidal sinuses are in the back, in the below the sila turcica. So this is all about the sinuses and their openings into the nose. Thank you so much.